Hey everybody, my name is Jake Schmidt, and along with my colleagues Haley and Abigail, we are going to present our topic, which is current and future directions for health informatics in patients and populations. So moving on to the next slide, just a quick overview. We'll talk about evidence-based applications in practice. We'll talk about the impact on quality, safety, and outcomes, some barriers, and then we'll pose some discussion questions. Moving on, just an introduction to evidence-based applications in practice. So I will tackle this first section. Really, I try to explore the evidence-based applications in practice through the lens of a couple different conceptual frameworks and their relevance to both, or I should say, to federal, professional, and industry. So the first is the federal policy framework. And in case you weren't aware of this, there is a federal presence whose responsibility it is to have some oversight of health IT and informatics in general. And that's the Office of the National Coordinator for Health IT, or ONC for short. Per their own site, they are the lead federal entity responsible for coordinating nationwide efforts to advance health information technology and promote and secure electronic exchange of health information. So that is their role. It is a federal agency, so it has tasks with some rulemaking, and it is housed within Health and Human Services, HHS, and it is currently funded. It has two overarching strategic objectives, as you can see here: advancing development and use of health IT capabilities and establishing expectations for data sharing. They frame their clinical relevance with four pillars. You can see here: interoperability, information sharing, standards, and policy. And really, they have a bit of a future focus. They are tasked with some federal rulemaking, so interpreting law, policy development, reports to Congress and other stakeholders. It has, and transparency had some challenges throughout its life, throughout its existence, with frequent political turnover, lots of leadership turnover, and a lot of reorganization that has kind of muddied the waters as far as what their specific role is. But as I just explained it, that is their current function and structure. So moving on to the next consideration, talking about professional organizations. So a big one for nurses is the American Nursing Informatics Association, ANIA. They are a professional organization with nursing informaticists membership. They articulate professional practice and are a certifying body for nurse informaticists. Their relevance is, of course, they articulate professional practice roles. They publish a journal and they generate some position statements useful to current practitioners with an ultimate focus on patients and populations. They do also have some future focus with some advocacy presence. The next group I wanted to discuss in terms of evidence-based application and practice is the industry. The industry representative, the big one in this space, is HIMSS, Healthcare Information and Management Systems Society. They are an industry society certifying body and accreditation entity, and per their site, they position themselves as an organizational partner and a thought leader. They have a yearly conference and a publication. A really interesting thing that they have been able to do and tie some evidence to a few case studies out there lately is something they call the maturity models. So they have maturity models for EMRs and health information exchanges. And they also have maturity models for a few other things, but this is the most applicable. And so they use this as a clinical benchmark for how far a system has progressed in its journey from perhaps no EMR at all to a dynamic health record. So you can see here a stage 0 organization is one that does not have any EMR of any kind. Maybe they're still doing paper charting. Maybe they have an idea but haven't started it yet. And all the way through stage 7, so there are 8 stages, is a dynamic health record. And the purpose of a dynamic health record, what that means to HIMSS, is that the organization utilizes dynamic tools, leverages some analytics and insights, and has some strategic health management initiatives involved. So what they're really looking for with the stage 7 organization is an outcome. They want to impact outcomes with the system. Of course, there is some advocacy presence, but the goal here really is a patient focus and a user experience focus with again, emphasis on the outcomes. And I wanted to talk quickly. There's lots of larger organizations that are stage 7 that you probably heard of. A couple on a quick internet search was UNC, Chapel Hill, Chicago North Shore. One I wanted to highlight, though, that I was able to find actual press release and information on was this organization called Antelope Valley, which is in California, which is not a major health system, but it sounds like more of a standalone organization. But they were able to get a stage 7 maturity model. And of course, there's a little bit of industry protection. We don't know exactly how they progressed from whatever stage they were into stage 7, but we know from their press release that they were able to use the EMR that they had and advance it to reduce some errors, added an antimicrobial stewardship program, and they were able to demonstrate that they improved patient safety via those methods with their EMR at a stage 7. So those are kind of the 3 areas I wanted to discuss, and now I will turn it over.
Okay, so now on to talking about impact on safety, quality, and patient outcomes. So in terms of quality, the quality of care given will drastically increase. Evidence-based practice will be the standard, and it will be based on certain order sets, certain clinical pathways, and clinical decision support systems, also known as CDS. Care coordination, a lot of us who have been seen by the doctor get follow-ups via email, text phone calls, and pretty consistent reminders about not only follow-up care, but appointments and learning opportunities. So care coordination will will also, the quality of that will drastically increase as well. Just like we learned in nursing school, the use of care plans, and again, the specific pathways will be used in terms of quality enhancement. For those who suffer from chronic disease, additional remote monitoring and convenient care essentially will address and acknowledge health concerns more frequently. And there are programs such as Hospital at Home that allows patients to be discharged from the hospital and follow up with a medic that will actually come to their house, do vital signs, speak to their physician via a Zoom or a Teams meeting, and carry out their care that way. And lastly, in terms of quality, improved interfacing, which is huge between our electronic medical health records and enhancing documentation because of that. I think we've all been in situations where we have not had the information that we wanted and essentially needed for patient care. So this interfacing will be a really, really big deal. As far as safety, safety with enhanced medication administration for sure. Medication confirmation using not only two providers, but the use of scanners and hard stops in the computer will decrease any kind of errors. There have certainly been pretty mainstream and popular stories about medication administration certainly turning into at some points sentinel events, and that's the last thing that we want. So medication administration and decreasing errors is of the utmost importance. A clear vision of possible impending issues. So essentially, if somebody has a quick deterioration, there will be systems in place that will be able to screen, acknowledge these issues to get the patients the care that they need so that their health status and their current status doesn't deteriorate. A little bit more about that as well as improvement within the diagnostic sector. Use of AI is probably at an all-time high at this point in time. And, certainly if we utilize the resources and make sure that they are valid and reliable within AI, double check what we learn and what we publish and what we use for evidence-based practice, AI can be an extremely useful tool. And in terms of diagnoses, also making sure we have imaging enhancements, making sure that we see everything on scans and MRIs and PETs and all that kind of stuff. Lastly, once again, for safety purposes, interfacing between EMRs, it's not only a convenience factor, but it is a safety factor. And again, we need to have information for our patients to make sure that our care is complete and whole. And lastly, for me, patient outcomes. Earlier intervention will certainly improve patient outcomes and decrease complications, along with the overall decrease in length of stay and readmission rates. My DNP project is actually on readmission rates after orthopedic surgery within 30 days. So that sector is certainly something that's very, very important to me. Interactive care is another thing that we can all attest to in terms of participation and feeling like you're being heard within your care. So making sure that there are communication opportunities and making sure that we have opportunities for our patients to feel heard. Minority care improvements. We want to make sure we have intentional care that acknowledges any kind of disparity. And once again, with the increased patient satisfaction scores.
As we think about implementing health informatics tools like electronic health records and AI-driven decision support, it's important to recognize that these innovations don't come without challenges. There are significant financial and technical barriers, including the cost of implementation, workflow disruption, and ongoing interoperability issues. At the same time, there are important ethical considerations, especially around patient privacy, data security, and the potential for algorithmic bias. These factors can impact not only how effectively these tools are used, but also how much patients and providers trust them. So when we talk about advancing health informatics, we also have to carefully consider these barriers and ethical responsibilities. Health informatics can improve care, but there are important barriers to implementation. One major challenge is cost. Upgrading EHRs, adding AI tools, improving cybersecurity, and training staff can be expensive, especially for smaller healthcare organizations. Another issue is alert fatigue, where too many system warnings can overwhelm clinicians and reduce trust in decision support tools. There are also privacy and ethical concerns. Because health informatics relies on sensitive patient data, organizations must follow HIPAA and protect confidentiality. In addition, algorithmic bias is a concern because AI systems may produce unfair results if the data used to train them is not representative of all patient populations, such as specific races or different genders or different ages. Moving forward, health systems need strong privacy protections, transparent AI, and regular bias checks to make sure informatics improves care in an ethical and equitable way.
Hello, it's Jake again. So I wanted to pose 3 discussion questions based on our presentation. The first is what level of federal oversight or involvement, if any, is appropriate for health information exchanges and EMRs with regard to interoperability and usefulness to patients and populations? The second is what factors would build a more resilient informatics infrastructure that would work for the organizations, providers, nurses, and patients of the future? And the third is kind of a big one. Who are the winners and losers when organizations adopt an EMR, and how can organizations adopt technology in a way that's responsible to their mission and their patients? How can nursing help both meet their goals? So as you consider those, the next several slides are our references. And thank you so much for your time.